Bismillahirrahmanirrahim. My affectionate students, Assalamu alaikum wa rahmatullah. Today I am going to discuss about Chloramphenicol, Macrolides, if possible Azoles, inshallah. Chloramphenicol, a nitrobenzene having nitrobenzene structure. It is a broad spectrum antimicrobials. It is a true broad spectrum, like tetracycline. Chloramphenicol also true broad spectrum antibiotics. That means it is effective against gram-positive as well as gram-negative microorganisms. It binds with 50S ribosomal subunit, and it is effective in enteric fever. Once upon a time, it was the drug of choice. It was the only drug available for treatment of enteric fever. In ancient, when there was no diagnostic facilities, it was thought that if the fever subsides by taking chloramphenicol, patient was supposed to suffer from enteric fever. And this drug is well absorbed drug, completely absorbed from the drug, highly lipid soluble drug, completely absorbed from the gut, distributed throughout the body, both inside the cell, outside the cell, and efficiently cross blood-brain barrier. Its concentration in brain, in CSF, and that in the plasma is equal. This drug is effective in enteric fever, as it attains high concentration in the brain. So it was used in the treatment of meningitis and brain abscess. Though alternate drugs are available, but it's still, because of its high sensitivity, it can be considered as a drug of choice in case of meningitis and in case of brain abscess. This drug enters into the bacteria as it is by simple division because of its high lipid solubility, and binds with 50S ribosomal subunit, and it inhibits synthesis, protein synthesis, and thereby it is a bacteriostatic drug. But there are some organisms which are highly sensitive to this drug, that is Haemophilus influenzae, Neisseria meningitidis, and Streptococcus pneumoniae. They are bactericidal. This drug is nowadays it is not used for the treatment of enteric fever because of its toxic effects. This drug produce toxic effect like bone marrow depression, aplastic anemia, agranulocytosis, thrombocytopenia. Because of this grave toxic effect, its use for systemic purpose, the treatment of enteric fever is now not acceptable, is obsolete. But this drug now is still used in the for local effect, because for the treatment of ophthalmic condition in eye and ear, this drug is used in the form of drop, in the form of ointment. Now this drug inhibits enzyme. This drug is metabolized by the liver and undergoes glucuronide conjugation, and this drug is eliminated through the metabolites is eliminated through the kidney. This drug produces grey baby syndrome, especially in premature baby, where glucuronide transferase enzyme is deficient and drug is not metabolized, not undergo glucuronide conjugation. So the drug remains as such. As is lipid soluble, it goes to the brain and deposited the basal ganglia, vital centers, and inhibits cardiorespiratory function, and there is palpitation, rapid 3D pulse, and respiration is suppressed, ashen color of the baby, there will be diarrhea, and that is known as gray baby syndrome. It occurs in case of premature babies. And as it inhibits enzymes, so there will be drug interaction occurs with this drug. Now, this drug, this drug and chloramphenicol belongs to true broad spectrum antibiotic. There are some similarities between them. Both of them are obtained from actinomycetes. Both of them inhibits protein synthesis. Both of them are broad spectrum, and both of them are bacteriostatic drug. But there are some differences between chloramphenicol and tetracycline. And regarding pharmacokinetics, differences are all chloramphenicol completely absorbed from the gut, whereas tetracycline absorption is incomplete. Though doxy and minocycline absorption is more, but overall tetracycline absorption from the gut is incomplete. Then food does not interfere absorption of chloramphenicol, but it interferes the absorption of tetracycline. And drugs like divalent cation, milk and milk containing food, then calcium, aluminum, magnesium, as well as iron, does not interfere absorption of chloramphenicol, but they interfere with the absorption of tetracycline. Regarding distribution, well distributed drug, completely distributed, well throughout the body, both inside, both outside, can cross blood-brain barrier in case of chloramphenicol, but this is not in case of tetracycline. Tetracycline cannot cross blood-brain barrier, and distribution is extracellular. Now, this drug undergoes metabolism inside the body, chloramphenicol, that is by gluconyl conjugation occurs. But in case of tetracycline, it is not metabolized inside in the body, and is excreted through the kidney. So these are the pharmacokinetic differences. Now, differences in sensitivity. Now, sensitive chlamydia are not sensitive to chloramphenicol, but sensitive to tetracycline. Rickettsia sensitivity less, but tetracycline more sensitive. Then protozoa. Against protozoa, it is not effective in chloramphenicol, but effective drug is tetracycline, both for treatment purpose and for prophylactic purpose. In case of malaria, tetracycline, I mentioned the previous point was for malaria. That means it is chloramphenicol ineffective, but tetracycline effective in case of malaria, both treatment purpose and prophylactic purpose. In case of protozoa, chloramphenicol not active, but tetracycline is active against Entaema histolytica, especially in luminal or intestinal amoebiasis. Now, bacteroids is effective against it. Chloramphenicol is effective, but tetracycline is not effective against it. Now, regarding adverse effects, chloramphenicol produces grey baby syndrome, but tetracycline does not produce it. Rather, it produces adverse effect on bones and teeth. There is, in case of below children, it will produce dwarfness because of the deposition of this drug on the growing end of the long bone, producing dwarfism, and also teeth deformities, maldevelopment, caries teeth formation, malcast formation, these will occur. Then superinfection is very common in case of, is uncommon in case of chloramphenicol, because it is completely absorbed from the gut. So no drug remains in the gut to produce superinfection, whereas tetracycline is a champion drug to produce superinfection. So these are the differences between tetracycline and chloramphenicol and tetracycline. This is a very important point. You have to remember it is important not only for Viva but also for MCQ. So SAQ. So please give emphasis on differences between tetracycline and chloramphenicol. And chloramphenicol inhibits enzyme, but tetracycline cannot inhibit enzyme. So drug interaction in case of tetracycline are of different type, and interaction in case of chloramphenicol are of different type. As chloramphenicol inhibits enzyme, so it can increase the effect of tolbutamide, it can increase the effect of warfarin, and in case of tetracycline, interaction occurs with divalent cations, iron. So these are the, in nutshell, differences between chloramphenicol and tetracycline. Both of them are synthetic natural drug and obtained from actinomycetes, and both of them are broad spectrum antibiotic and bacteriostatic. And they are bacteriostatic, so they will not kill the organism, but the individual who suffers from that organism treated by this drug, either tetracycline or chloramphenicol, so he or she, patient, will become infection free, because as there is no growth and multiplication of the bacteria, so bacteria become weak, and the body's defense mechanism phagocytose this organism, and in this way individual becomes infection free. And now another important group is macrolides. Macrolides means macro large, leads lactone ring. Macrolides means drugs having large lactone ring in their structures. These groups are natural drug. They are obtained from actinomycetes. Here the members usually erythromycin, clarithromycin and azithromycin. Their pharmacokinetic properties more or less alike. They are more effective against gram-positive organism. Now regarding erythromycin, it is effective more against gram-positive organism. It is used as an alternative to penicillin. Those patients who are sensitive to penicillin but cannot be given because of allergic reaction or hypersensitivity reaction, then in this situation, macrolides is an alternative. This erythromycin, this drug, use erythromycin isolate taken orally, and in the intestine, isolate portion is separated and the drug is absorbed from the intestine. And drug absorption is completely well absorbed, very well absorbed drug, well distributed drug, and and this drug in liver, this drug undergoes excretion through hepatobiliary system. Through hepatobiliary system, the drug is excreted, and this drug is a very safe drug. It produces time-dependent killing. So the drug, we have this erythromycin given 4 times a day. Before lowering the minimum effective concentration, drug has to be repeated. Now this drug, erythromycin, used in case of mycoplasmatic pneumonia infection, Legionella, diphtheria, pertussis, chlamydial infection, gastroenteritis by Campylobacter jejuni, Treponema pallidum, alternative to penicillin. Now it is also used in case of acne, where this drug suppresses bacterial lipolysis of sebum, which generates fatty acid leading to inflammation, leading to inflammatory reaction. So these are the in nutshell about erythromycin. This drug concentrated in the gram-positive organism because it has got high affinity for the gram-positive organism. So it penetrates by simple division well and interferes protein synthesis. So they are bacteriostatic drug. the enzyme inhibits enzyme, so they can increase the active effect of terpenoidin, ergot, theophylline, etc., and they are increasing their toxic effect. Now the another member is clarithromycin. This drug, its pharmacokinetics is identical, almost identical to that of erythromycin, but it has more effectivity against Haemophilus influenzae, and it has got one important characteristics, that it follows saturation kinetics. It follows saturation kinetics, means here if the drug dose of the drug is increased, then a constant amount of the drug will be eliminated. There is more chance to produce toxic effect. So this drug, this is the peculiarity of clarithromycin, that it will produce zero order kinetics or saturation, it follows saturation kinetics. Now this drug is used in case of respiratory tract infection, atypical pneumonia, soft tissue infection, and then in case of peptic ulcer, to eradicate Helicobacter pylori. This drug is concentrated intracellularly. Regarding toxic effect, this drug less toxic effect may produce cholestatic hepatitis and sometimes GIT upset, nausea, vomiting, but there is no opportunistic infection. So these are very safe drug, and in case of cholera, the infant drug of choice is erythromycin, and if the adult, if patient is adult, then the drug of choice is in that case drug of choice will be tetracycline. Now among this group, azithromycin, this drug more effective against gram-negative and relatively less effective against gram-positive. They are effective against Haemophilus influenzae, Neisseria gonorrhoeae, chlamydia, and they are used in case of respiratory tract infection, soft tissue infection, sexually transmitted disease, then travelers diarrhea, then pseudomonas infection, cystic fibrosis, enteric fever. Now these are the drugs which is nowadays, this is very extensively used in case of enteric fever, and this drug has got high intracellular binding capacity. Its half-life is about 50 hours, so single daily dose, patient's compliance is very good, and treatment is for treatment is for 3 to 5 days. So these are the advantages, and for that reason this drug is now considered as P drug or primary drug or personal drug for the treatment of enteric fever. Though there are alternative drugs for the treatment of enteric fever, like cotrimoxazole, like ampicillin, like amoxicillin, then cephalosporin, ciprofloxacin. Ciprofloxacin was the best drug, but nowadays it is the drug of choice is azithromycin because of its cost effectivity. Drug can be given orally for 3 days treatment, 3 to 5 days treatment. So these are very effective drug. So drug of choice now is azithromycin. Now another groups, that is azoles. Azoles are drugs. They have got azole nucleus in their structure. These drugs are the azoles are all synthetic drugs. They can be grouped as it may have antibacterial and antiprotozoal activity, it may have antifungal activity, it may have anthelmintic activity. Among the antibacterial and antiprotozoal activity, drugs are metronidazole, tinidazole, secnidazole, or nidazole. And among the antifungals, there are two groups. One is triazole and imidazole derivatives, and the examples are fluconazole, ketoconazole, iconazole, miconazole, itraconazole. This belongs to this group. And regarding anthelmintics, there are drugs like albendazole, mebendazole, and thiabendazole. These azoles are, they have got azole nucleus in their structure. All of the members are synthetic synthetic drugs. Now the antibacterial and antiprotozoal activity is most common drug is metronidazole. Metronidazole is imidazole derivative, nitrobenzene derivatives, and this is widely used, extensively used throughout the world. This drug can be used by oral route, can be used by rectally, can be used by intravenous route, can be used by gel in the form of gel. Now this drug, how does this drug produce its effect? This drug is highly selective for anaerobic infection. For anaerobes, this drug enters into the microorganisms by simple diffusion. Not only enters into the anaerobes, but also enter into the aerobes. But only in anaerobes it undergoes nitro reduction and forms active metabolite. But in case of aerobes, it cannot undergo nitro reduction, so it cannot be converted to active metabolite. And this active metabolite now binds with the metabolite binds with the nucleic acid, incorporates with the nucleic acid, and ultimately this system of DNA, RNA, messenger RNA, ribosomal RNA, messenger RNA, and ultimately interferes its synthesis, thereby function, and ultimately this drug is bactericidal. Now this drug is used in the treatment of sepsis and anaerobic infection. The situations where it is used is post-operative infection, abdominal infection, septicemia, osteomyelitis, then abscess of brain, lung, and pelvic abscess. In this situation, these are the drugs used. And it is also used in case of pseudomembranous enterocolitis, which is produced by the broad-spectrum antibiotics due to suppression of opportunistic the withdrawal of suppression of opportunistic infection. They will flare up and produce infection, that is pseudomembranous enterocolitis. In this situation, broad-spectrum antibiotics must be withdrawn and can be treated with metronidazole. Another drug that can be treated in this situation is vancomycin, but vancomycin is very costly and is more toxic and not available. But available and affordable and a very cheap drug is metronidazole. That's why it is the drug of choice for superinfection. It is also used in case of trichomoniasis, then amoebiasis. In amoebiasis, both intestinal as well as extraintestinal, luminal or extraluminal, in both this situation, this drug can be used. It is also used in case of giardiasis, then gingivitis, dental infection. Dental infection it also be used. Now it is used also in anaerobic vaginosis. So these drugs are extensively used throughout the world, and they have got toxicities like GIT upset, then metallic taste, glossitis, anorexia are produced. Sometimes when used for prolonged period, it may produce convulsive threshold may be decreased, and there will be chance of convulsion. And these are the toxic effects this can be produced. And this drug also inhibits enzyme system. And there is another reaction it can produce in alcoholic. It can produce disulfiram-like action. That means this drug inhibits the enzyme alcohol dehydrogenase and aldehyde dehydrogenase. When it blocks the alcohol dehydrogenase, there will be increased accumulation of alcohol will be converted to aldehyde. There will be accumulation of aldehyde, and this formaldehyde, and this is a toxic substance, and patient will complain, see burning, excruciating burning sensation throughout the body. And in this way, if he or she does not know that it is the drink mixed with metronidazole, so he or she may be averse from taking this alcohol. In this way, we can abstain that individual from indulgence to alcohol by mixing metronidazole with alcohol without knowing the individual concerned. This is also known as aversion therapy, and this is one of the beneficial effects of this drug. Now another group is quinolones. Quinolones, all the members of this group are synthetic. First member of this group is nalidixic acid, which was used in the treatment of UTI, because this drug is concentrated in urinary tract, but its systemic concentration is very scanty, so cannot produce systemic, cannot be effective against systemic infection. And this drug, when there is addition of fluorine in its structure and it becomes fluorinated quinolones, then it's become broad spectrum. It is broad spectrum antimicrobials. Initial generations were more effective against gram negative, but the later newer generations are more effective against gram positive. Ciprofloxacin, ofloxacin, norfloxacin, pfloxacin, then levo, gatti, lomi, moxifloxacin are available, and these drugs, levofloxacin, moxifloxacin, gatti and lomifloxacin, they are effective. They are also known as respiratory fluoroquinolones. Also, they inhibit DNA gyrase, bacterial DNA gyrase enzyme. Mammalian counterpart is insensitive, but the bacterial counterpart is very sensitive, and they inhibits the enzyme DNA gyrase, thereby inhibits supercoiling of DNA, which is necessary for compacting of chromosomes in the brain. These drugs are used in case of respiratory tract infection, GI tract infection, UTI, then STI, STD. In this situation, these drugs are extensively used. Now, the toxic effects of these drugs is they will produce the arthropathy, tendinitis, and there may be the patient who is increased intraocular pressure, they may produce the convulsion. So these are in nutshell about quinolones. Now, important thing, there are some antimicrobials which can inhibit the enzymes, and this is important for MCQ. What are the enzymes? What are the antimicrobials in which enzyme system? Example are chloramphenicol, erythromycin, clarithromycin, quinolones, INH, ketoconazole. These are the inhibits enzyme, and there is enzyme inducer, that is rifampicin. And antimicrobials which are safe during pregnancy are penicillin, pipmecylinum, nitrofurantoin, erythromycin, clarithromycin, azithromycin. Thank you for your patient hearing. Assalamu alaikum wa rahmatullah.